Dr. Ismail Bey is a specialist with over 12 years of experience, actively working in the field of hair transplantation. To date, he has successfully performed more than 2,500 hair transplant operations on the scalp and facial areas. He works with modern and advanced hair transplantation techniques.
Hello.
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 Dr. Ismail Bey, we would like to ask you a few questions.
Of course.
Thank you. Dr. Ismail Bey, what are the most effective methods for hair transplantation and how do they differ from each other?
The most effective and the newest method we use for hair transplantation in Turkey is the DHI technique, the DHI method. Generally, techniques like FUE and Sapphire are also applied. However, these techniques were introduced to our country around the year 1995, and since 2014, DHI has been successfully used in place of FUE. What are the differences for us? In the past, with the FUE or Sapphire method, we couldn't control the direction of the hair very much. But now, thanks to the DHI pen, we can both extract the hair according to its original direction and make our patients' lives much easier. In other words, a patient who has undergone the operation can freely return home the very next day. Under certain protective conditions, they can even return to work after the third day, because we don't leave an open wound on their scalp.
Thank you. So, what is the ideal age for a hair transplant?
Actually, there is no such thing as an ideal age for a hair transplant. This is entirely related to the patient's own psychological state. In the past, there was a bit of a misconception about this topic. Like, you're only 22, 23 years old, you can't get a hair transplant. But let's also look at it from the other side. Today, a patient who is 23 is really just at the beginning of their life. So telling this patient to come back when they are 35 is a bit unfair to them. If necessary, if the patient's donor area is strong and examination shows that a hair transplant is needed, the procedure can be done at 22. It can also be done at 23. In a possible scenario, if the hair extraction is done properly and the patient loses their own existing hair or the transplanted ones by the time they turn 30, they can have another transplant done. This way, he never has to go through any period of his life without hair.
Thank you. Dr. Ismail, what kind of side effects can occur after the hair transplant procedure?
The risk of complications with the DHI technique we use is almost negligible. Dr. Ismail, thank you very much for your comments.
You're welcome. Thank you. Our dedicated doctor's mission is to significantly improve the overall quality of life for their patients and to consistently earn their complete trust.
If you have any questions, please feel free to contact us. We are always very happy to help, indeed.